So, Gene, what are some of the major sticking points that people have about getting dental implants, and how would you advise they overcome them?
Well, I think most people think they're expensive.
Mm-hmm.
So the cost, so they're like, well, what's the cost? Is my insurance going to cover it?
Right.
Why go through this? I mean, I'm okay without a tooth there.
Mm-hmm.
So really then it comes down to educating the patient of the importance of replacing the tooth.
Right.
And if you don't, the effects of it. So then they think,
Could you go into the effects just a little bit so we understand that a bit better in terms of what are the advantages or disadvantages of replacing the tooth?
well, if you don't replace the tooth, the forces that are generated when you bite have to now be distributed among less teeth.
Okay.
So regardless, the force is 100%. So if you take a tooth out, it's still 100%. So where does that other 10 or 15% the force that
On
tooth
the
was
other
taking?
teeth.
On the other teeth. So you get a domino effect.
Right.
So you lose one tooth, then you lose 2 teeth, then you lose 3 teeth. It certainly decreases your ability to chew. It causes teeth to shift, so it can throw your bite off.
Mm-hmm.
So those are all reasons why you'd want to replace it. Then the question is, well, what are the options? We talked a little bit about partial denture.
Right.
That's the least expensive, least invasive, but probably the most bothersome,
Yes.
and the one that the compliance on it is very low.
Mm-hmm.
And most of those partials, I mean, if I got $1 for every partial that's sitting in somebody's drawer, I'd be a very wealthy man.
Right.
I mean, they're not comfortable.
Mm-hmm.
The second option, and not in any preferable order, is a bridge. You got to cut adjacent teeth down,
Probably healthy teeth too.
and a lot of times it's healthy teeth.
Right.
So, and both option 1 and 2 do not preserve the bone.
Mm-hmm.
So then, if you look at cost, the cost of a bridge, a 3-unit bridge replacing one tooth, is going to be about the same as an implant.
Really?
Yeah. So there really isn't a cost factor when you consider that. It's probably double what it would be for a partial denture, but
Right.
if you're going to put a bridge in, so if cost was your issue, why wouldn't you do that?
Mm-hmm.
You're going to save cutting down the other teeth. Plus, actually, it's cheaper because if you do a bridge, I can guarantee at some point in your lifetime it's going to need to be replaced.
It's going to fail.
So if you're 50 years old, you might need and you live to 90, you might need to be replaced 2 more times.
Right.
So it just doesn't make sense. And whereas the implants, I said, we talked earlier in our discussion, they can't get decay, they can't get gum disease. So the cost factor is really, unless you're going to go with a partial.
Yeah, in fact, you could probably argue that it's the least expensive other than the partial, than the denture.
Yeah, but you're also doing the same thing with the partial. Guess what? They don't last.
Right.
Or they don't even last as long as a bridge.
Right.
So they're uncomfortable. I can't tell you how many patients I've had with partials that they lose them.
Really.
Yeah, they're at a restaurant. Of course, they don't want to take it out while they're at a restaurant, so they'll go in the bathroom, maybe take it out, clean it, put it in a napkin, whatever they do, and they leave it somewhere. It gets lost. They can't find it. So I've seen a number of patients who spent whatever it was for the partial, and within a year they lost it. They had to buy another one. So now they're up to the cost of an implant. So the only if you're talking about price, is if you were missing multiple teeth.
Right.
Let's say you were missing 8 teeth on the top. Obviously a denture is going to be a lot less expensive. But you're going to have all the problems with chewing, with the denture falling out, with having to replace the denture, with not being able to taste your food because it's covering the palate.
Yes.
Yeah. So there is those factors, I think, are not beneficial enough to accommodate the difference in the cost. And there are other options. You can do, for example, a hybrid type thing. You can put like 2 implants here and 2 implants here, and then put a denture in there and it pops into place so
Right.
it stays. So that's, or you can even do like a bridge like that. So there are a lot of other options that. The other, I guess, objection is that there's a surgical procedure involved in the
right.
implant.
Right.
But I can tell you this, it's not that big a deal of course, I'm saying that from the surgeon's
Yeah.
perspective. I know it is from the patient, but to ease their mind, in order for the place an implant, that means the tooth was taken out. And I can tell you, having a tooth extracted is much more traumatic. So,
Really?
and the analogy that I use is that think about a time when you went out into the front yard and you dug a hole and you put a plant in. You know, so you dig a nice hole, move the dirt around, put the plant in, push the dirt over it. That's like doing an implant.
Gotcha.
Now, 5 years from now, that thing dies, and you want to put a different plant in there, and you want to dig it up. You got all these roots growing all over the place. So think of the ease of putting that plant in versus the removal. So it's sort of like
Oh, I gotcha.
how more difficult it is to take a tooth out, which you've already done, so you know what that's like, and now you're going to put an implant in. So think about the implant as that, just like the plant, you did a little hole, put the implant in there.
Right.
So the surgery, yeah, it's still surgery. You got to get anesthesia, but it's not as big a deal. But I think there's sort of a misunderstanding because people think it's a big deal. Now, there was a time when that was a big deal.
Right.
So without going into the gory details, but the implants from the 1970s and 80s was quite extensive
Really?
amount of surgery.
Yeah.
This is now a very, very simple process.
Okay.
I can't think of any other reason why people would object. It would be the cost, which we covered, the surgical procedure. I don't know. They're anti-implants. Some
Anti-implants.
some new movement, some new organization. Whatever, for whatever reason. So, well, I mean, there are. If you want to get truly biological, anything that's implanted into living tissue is an issue.
Right.
So it's not. If we had stem cells, zirconia implants, titanium implants, I would do stem cells.
Stem cells.
Guess what? We don't have that
We
available.
grow the new teeth.
We
It'd
grow
be
new teeth.
Your teeth.
Yeah. Right now, June
So-
2015, we don't have that available.
So other than that, what do you see as the future of dental implants? What, where do you see dental implants heading in the next months or years?
Well, I'd say based on statistics of baby boomers, starting to retire, they have the money to afford these things, and the statistics say that at the age of 60, I forget what the number is, somewhere like 75% of those people are missing at least one tooth.
Right.
So, and then certain percentage are missing 2 or 3 teeth. So you're going to see a similar thing we saw in our parents' generation, but the options were partial dentures for the most part. At least that's what I remember. My grandparents, they all had dentures. So I think with the available discretionary funds, the advantage of an implant over partial, I think people are more prone to do that where they wouldn't do a partial.
Right.
They say, I'm not doing a partial no matter what. Even if it does provide additional function, prevent the teeth to shift, they're just not going to do it. So I think now that we have something that's more comfortable, it's more natural, I think it's going to be, if it's not already, the growing part of dentistry that was similar to the cosmetic dentistry of the 90s, when everyone wanted new veneers and whitening and
Yes. So what it's going to take, however, is education. People need to understand these new changes, the new technology, the new material that's being used, the ease of it. It's just then a matter of getting the word out, essentially, which is what this video is about.
Exactly.
So-
Well, I mean, people don't do things because they're confused, they don't understand, so they do nothing if they're confused. 2, there's some level of fear because of the unknown, because they picture in their mind, implant. I mean, if you think implant, what are you talking about? Like a knee implant, like a hip implant? I mean, that sounds pretty aggressive. That sounds pretty traumatic, but it's not. It's not for a tooth implant.
Good.
So there's a lot of promise there. I think it's going to really change the face of dentistry. The other piece that why I see it is the number of marketing pieces that are coming out on a regular basis. And this goes back to, it's also, for me, I think it's going to be a great concern, is a lot of dentists are taking weekend courses, and Monday morning they're starting implants.
Yeah.
That is not something you should be doing without extensive training. extensive training and technology.
Yeah.
So if you have that, I think that general dentists can do this.
Mm-hmm.
So you don't have to be a surgeon. As I said, I know surgeons that I deal with now did the same thing I did, because when they did their residency, they weren't teaching implants like we did.
Right.
So they had to take a course. The difference is they obviously have a lot of surgical experience,
Mm-hmm.
but so do I. I mean, I did a residency, so
Yeah.
and I've been doing surgery, and I do a lot of extractions, mainly because we don't believe in root canals. So it's just a nice fit for me to go from
Mm-hmm.
A to Z.
Yeah. So, coming from the perspective of the general public, how would a person know whether or not a dentist has the kind of background and training that would be required to do this effectively?
Well, I think it's your right to ask.
Well, what would they ask though? What would I ask you? It's like,
what degree of training have you had?
okay.
And if they start, I took a course, or did they take a program that was comprehensive?
Mm-hmm.
As I said, mine was over 130 credit hours,
Right.
plus live participation,
Supervised.
live training.
Right.
So that's what you need to do.
Mm-hmm.
To have this. If you've taken a weekend course, it says Monday, and a lot of these weekend courses also, they're placing implants in pig jaws.
Right.
That's their experience. So Monday morning, they bought themselves an implant kit, and they're starting to place implants.
Right.
So now, I think that some of the material I've read is convincing that you really can do this. And there are probably some that they can do.
Mm-hmm.
Hopefully they're being very selective,
Right.
but I still think it's not adequate. So I would ask for some certification, some program
Okay.
that you've taken.
Okay.
Yeah.
Very good. Okay, that's pretty much all that I had to ask. But one last question. Is there anything that you could think of would get the audience's heart racing if they just knew about it in terms of dental implants?
I think now the ease of it, like we talked
Mhm.
about. So it's funny you asked that question, because this Monday we have a patient who is in, I think it's her son's wedding is next weekend,
Uh-huh.
and she's freaking out because she doesn't have a front tooth.
Oh my.
So we're going to deliver her a front tooth Monday.
Ah, very
So,
nice.
whereas before we would say, nah, well, what we could do, we could make you this little flipper thing that puts in and out. And
Mhm.
so that I think is very exciting, is that one, the procedure is not as traumatic as it used to be. Two, the delivery is easier and faster. And the cost is really, I said, in alignment with what it would cost to get a bridge.
Right.
So, and with the zirconia, because it's more compatible and more aesthetic, that's exciting.
Yeah.
Because I've seen a lot of patients who've had titanium, and their biggest complaint is that they see this black line up at their gum line.
Yeah, I've seen that.
So, yeah, so you got a nice, pretty crown, and they smile, and you go, there's something on your gum there.
Right.
So with the zirconia, even if you got recession, it's not going to stand out.
Well, thank you. It's been very informative, and I hope you folks have learned something good about this. We'll be looking forward to talking more.
Okay, me too.